This is Mansi Shah, working as an assistant professor in LG Institute of Pharmacy. I welcome you all in this semester 5. So today's our discussion topic is on anti-anginal agents. So in this session, I will discuss with you regarding angina, how it occurs and what is the treatment for angina. So let's start with our today's session, that is on anti-anginal agents. So today's session is about anti-anginal agents. Let's start with it. So first of all, what is angina? Angina, it is nothing but a syndrome, or you can say a symptom which is resulting from transient myocardial ischemia, right? That is, it is a cause of ischemic heart disease. It is nothing but chest pain. So chest pain, it is called as angina. Now this angina, it radiates from chest to lower jaw, to shoulders, to back, right? How angina occurs? So this is a pictorial diagram representing how angina pectoris occurs. So it is nothing but, first of all, spasm or obstruction of coronary arteries occurs. This occurs due to atherosclerotic plaque, right, which causes myocardial ischemia, which causes reduced oxygen supply to myocardium, and which results into chest pain, that is angina. Then what are the types of angina? So as I've told that angina, it is nothing but chest pain. Now there are three types of angina. That is, first, that is stable angina, second, that is unstable angina, and third, that is variant angina. Now in stable angina, as you can see in figure, that how the normal lumen or normal coronary arteries, right? And what occurs in stable angina? So there occurs a formation of atherosclerotic plaque, right? Due to the formation of atherosclerotic plaque in coronary arteries, right, due to deposition of this fatty material, it results into difficulty in oxygen supply to the myocardium, and this results in myocardial ischemia, which results into angina. This type of angina, it is called as stable angina. Second, that is unstable angina. Now unstable angina, in unstable angina, atherosclerotic plaque, it is followed with clot formation, right? This clot formation, or you can say this thrombus formation, right? It is not only moving, it is not only stagnant in that one portion, but it is moving around the artery, and it is moving and blocking different parts or different organs, right? So if the blockage occurs in say brain, then occurs stroke, right? So, and if such kind of pain occurs, right, that is called as unstable angina. And third, it is variant angina. As you can see that there occurs severe coronary spasm, so there is so much difficulty of oxygen consumption by the heart, right? And there occurs very much myocardial ischemia. This is, and the pain which results due to that, that is called as variant type of angina. Now, angina, that is nothing but it occurs due to the imbalance between oxygen demand and oxygen supply, right? So if the oxygen demand by the heart is more but supply is less, then this can result into ischemia, and finally it can cause angina. So what is the treatment for that? First, that is nitrates, right? They are used. Second, there is calcium channel blockers. Third, beta adrenergic blockers. Fourth, potassium channel openers, and miscellaneous drugs, they are also used. In miscellaneous drugs, there are antiplatelet agents. They are also used, right? Now, first starting with organic nitrates. So mechanism of organic nitrates, as I have told, that because of atherosclerotic plaque, right, there occurs coronary spasm, there occurs obstruction. So the treatment for angina is that we need dilatation of arteries for more blood supply, right? Because there is reduced amount of blood supply, and because of that there is reduced oxygen supply to the heart, which results into ischemia, right? So nitrates, it nothing but it causes relaxation of smooth muscle, that is dilatation, right? Now nitrates, they are released nitric oxide, right, which increases the level of intracellular cyclic GMP, which causes decrease in the amount of calcium, and which causes relaxation of smooth muscle. So this is the mechanism explaining about nitrates, right? Now the pharmacokinetic of nitrates. Nitrates, they are always used through sublingual route, right? They are always available as tablets, whether it is nitroglycerin, isosorbate dinitrate, or isosorbate mononitrate. All these, they are available as oral tablets, because the first part, like metabolism of nitrates, right, is very much less when it is taken orally. Right? The nitrates are inactivated in liver by glutathione or organic nitrate reductase. Right? And pharmacological actions of nitrates on smooth muscles, other smooth muscles such as bronchi, esophagus, biliary tract, they are also relaxed by nitrates. Then pharmacological actions on vascular smooth muscles. So on venodilatation and arterial dilatation. These two type of dilatation it causes. On venodilatation, it causes peripheral pooling of blood, which causes decrease in venous return to heart, which causes decrease in preload, and which causes decrease in left and right end diastolic volume and pressure, which causes decrease in cardiac work, which causes decrease in oxygen requirement of myocardium, which relieves the pain. Now, by arterial dilatation, it causes decrease in peripheral vascular resistance, which causes decrease in afterload, and this relieves the pain. Now, what are the adverse reactions of nitrates? So first, it causes postural hypotension or syncope. Then second, it causes tachycardia. It causes drug rash. It causes facial flushing. It causes methemoglobinemia. It causes thrombic headache. Right? This is just a chart explaining what is thrombing headache, right? Where it occurs, on which part, and it is said as thrombing headache. Right? Then it also causes Raynaud's syndrome. The next is the drug interactions of nitrate. So sildenafil and other vasodilators, they potentiate the hypotensive action of nitrates, right, which causes sudden myocardial infarction and sudden death. Now the next is calcium channel blockers. As the name suggests, it causes blocking of calcium channels, right? Now the classification for that is verapamil, diltiazem, nifedipine, amlodipine, famlodipine, right, and many others. So the basic mechanism of calcium channel blockers, as the name suggests, that calcium channel blockers. So it blocks the amount of calcium which is being released by calcium channel, right? So what occurs? Calcium channel, if it is blocked, so if the calcium ion is blocked, then it causes dilatation of the vessel, of the blood vessels, right? So calcium channel blockers, it causes dilatation of arteries, right? If the calcium is released, then it causes constriction of the vessels. So this constriction is being blocked by calcium channel blockers, which hampers its release, right? And it causes dilatation. Now, role of nifedipine. So nifedipine, it is mainly acting as an arterial vasodilator, right? This drug has minimal effect on cardiac conduction or heart rate. Now, nifedipine, it is administered orally. It is usually used as extended release tablets, right? It undergoes hepatic metabolism to products that are eliminated in both urine and in feces. Now, nifedipine, it is useful in treatment of variant angina, right? And adverse effects of nifedipine is that it causes flushing, headache, hypotension, and peripheral edema. The next is about verapamil. Verapamil, it slows cardiac atrioventricular conduction directly, and this decreases heart rate, contractility, blood pressure, and oxygen demand, right? Then the drug is extensively metabolized by liver. Therefore, care must be taken that it should not be administered in patients having liver dysfunction. Verapamil, it is also contraindicated in patients with pre-existing depressed cardiac function or AV conduction abnormalities. It causes constipation. It should be used in patients who are on digoxin therapy because it potentiates the action or it increases the level of digoxin. The next is diltiazem. Diltiazem, it dilates peripheral and coronary arteries, right? It causes negative inotropic, chronotropic, and thrombotropic effects. It is used in the treatment of angina, hypertension, and supraventricular arrhythmias. Now, as I've told, the mechanism of calcium channel blockers, so in this verapamil and diltiazem, so it is explaining that it causes coronary artery dilatation, and this causes relief in coronary artery spasm, right, which decreases myocardial oxygen demand, right, which decreases vascular resistance, decreases the afterload, right. All this decreases heart rate, contractility, and AV conductivity. Now about next, that is nifedipine, right. So nifedipine, it causes inhibition of cardiac functions. How inhibition? So it decreases heart rate, but it causes reflex tachycardia. It causes decrease in AV conduction and decrease in contractility. The adverse reactions of calcium channel blockers it causes dizziness, ankle edema, headache, hypotension, flushing, constipation, AV block and heart failure with verapamil and diltiazem, and with reflex tachycardia. This is an adverse effect of nifedipine. The drug interactions, right? So as I've discussed earlier that verapamil or diltiazem, it should not be taken with digoxin, right? Or the patient having or a patient who are on treatment of digoxin, because it increases plasma digoxin levels, right, by decreasing its excretion. Then it should not also be given with beta blockers, right? Then it should not be used with cardiac depressant drugs like quinine and disopyramide. Then all calcium channel blockers, pharmacokinetics is that all calcium channel blockers, they're absorbed through GI tract but undergo varying degree of first pass metabolism, right? They're highly bound to plasma proteins metabolized in liver and excreted in urine. Uses of calcium channel blockers is that it is used in angina pectoris, right? Which type of angina? So it is used in variant angina, unstable angina. Then it is used in hypertension, supraventricular arrhythmias, migraine, renal phenomenon, and hypertrophic cardiomyopathy. Next is the mechanism of beta blockers. As the name suggests, beta blockers. So it inhibits the action of beta receptors which are present in heart, right? By inhibiting or blocking beta-1 receptors in heart, it causes decrease in heart rate, decrease in force of myocardial contraction, decrease in cardiac work, and this decreases myocardial oxygen consumption. Adverse reactions of beta blocker is that it causes fatigue and weakness, it causes nightmares, hallucinations, depression, it masks signs of hypoglycemia, then it increases the level of plasma triglycerides and decreases HDL cholesterol level. And on discontinuation of its therapy, it causes increase in angina, right? The other adverse reactions are that it causes chronic heart failure, it causes AV block, bronchospasm, cold extremities, and worsening symptoms of peripheral vascular disease. And it also causes hypotension. The next is potassium channels opener, right? Now there are three types of potassium channel. First, that is voltage gated potassium channel, second calcium activated potassium channel, and third, that is ATP sensitive potassium channels. So in voltage gated potassium channels, these channels open when cell is depolarized and therefore it helps in the process of repolarization. They are mainly present in vascular and other smooth muscles. Calcium activated potassium channels, and it causes increase in intracellular calcium concentration, which causes opening of these channels, which results in repolarization. Then ATP sensitive potassium channels, they are present in cardiac muscles and beta cells of islets of Langerhans of pancreas. Then the pharmacodynamics, so how it is acting. On vascular smooth muscles, potassium channel opening, it causes hyperpolarization which results in vasodilatation, and on cardiomyocyte it causes repolarization which decreases cardiac work. The next is the targets of antiplatelet therapy, right? So as I've told that apart from all these agents, antiplatelet therapy it is also used. Why? Because there is a formation of clot in sometimes, right? Sometimes that occurs clot formation, right? For example, in unstable angina. So in antiplatelet therapy, aspirin is used, then thrombin inhibitors is used, then ADP receptor antagonist, that is clopidogrel, is used, phosphodiesterase inhibitors, that is dipyridamole, is used, and fibrinogen receptor antagonists, they are used. Now miscellaneous agents. In miscellaneous agents, cytoprotective agents, for example, trimetazidine, it is used, right, which reduces myocardial oxygen demand. The next is ranolazine, right, it also inhibits late potassium current and it is used in the treatment of chronic and resistant angina, right? And the next is ivabradine. Ivabradine, it is also a pure heart rate lowering agent, or you can say it is a bradycardic agent, right? It decreases oxygen demand and decreases heart rate. So students, I hope you all have understood regarding anti-anginal agents, right? Now, next is, these are the frequently asked questions in your examinations. Just go through it. These are the references. And so, here I am concluding my lecture. For more such videos, please like and subscribe our YouTube channel, Pharma Ignite. Thank you.